welcome to our MedTalk today. I'm really looking forward to this one with Mark from the Gibson Research Consultancy. And we are going to talk about storytelling and the power of metaphors in medical writing. Hi, Mark. Nice to see you again here. You're a loyal MedTalker.
Yes.
How are you today?
And hopefully sponsor as well soon.
Yes, I'm looking forward to that one.
Yeah.
Hi, Noor. She says hi too. Wonderful. Mark, why are we meeting here today? It's nice to see you.
Yes. So, first of all, we're meeting because I got infected by this book for reasons that we'll explain. So, I mean, well, the reason being the topic of the conversation today is about metaphor and using metaphor in health communication. And so I've been collecting, like actually genuinely collecting in notebooks and things, metaphors, instances of metaphors for about 30 years. I mean, it's just such a tragic hobby. Can you imagine being on the dating scene, like a divorced dad or something like that, going dating, and the person says, "What's your hobby?" And I say, "I collect metaphors." So no.
Well, there are worse hobbies. No, there are worse hobbies. I'm really looking forward to your collection and especially to your conclusion. So, what do you think? You don't talk about metaphors only in medical writing. You keep that a bit more broad, also in business metaphors and actually all day, like everyday life metaphors. We keep talking in metaphors, and often we don't even know about it.
Yeah.
Yeah.
Just, it's funny because just as I was coming into the office, there was one of the people who rent an office space further down the road. She started coughing, and she was with a small child. He was about 4, and she said, "Oh, I have a frog in my throat." And it's great because you can tell when children often offer verdicts on metaphors, and he looked at her. He said, "You have a frog in your throat." He was only 3 or 4 year old. It was so funny, and I just thought it was such an opportune instance of a metaphor just as I was coming into this. And so over the years, I've been reading lots of texts. Like one of the key texts is this Susan Sontag, Illness in Metaphor, which is about cancer and HIV and the war metaphors that we'll talk about. And this one, Rika, is a key text. I've got the French version somewhere. And just other books here, like Figurative Language is a standard textbook. And metaphor is, of course, part of figurative language, which I learned from Katrin is Stilmaterial. Is it? Stilmittel.
Stilmittel. Stil, not Stilmittel.
How is it? Not sh?
It's so it's a Stilmittel in German. Yeah, we discussed that term because I wanted to know what the English word for it is. And as Mark speaks also German, that's why I asked him. So figurative language.
And then there's this issue of dead metaphors. So there are metaphors all around us that we use that are basically dead, like muscle. Pretty much how the human body was carved up is use of metaphor, particularly the female body as named by men. And these are metaphors that are dead and forgotten about, but still form the basis of how we view, how we perceive the body, the male body and the female body. One example is, just the idea of fertility, where a woman was equated with soil, and so you were either fertile, or this awful term that is common to pretty much every culture, barren. In Spanish, there's an awful term, yerma, which is that, and it was the title of a book from Garcia Lorca in the 30s, just particularly about a woman who couldn't give birth. And of course, there are dead metaphors. If you just look at your computer screen, a Word document, you see all of these symbols, visual symbols that relate to technologies that are long gone, like the floppy disk or save, and the shopping cart and that kind of thing. And Carol, I'm really happy and intimidated that Carol van der Waarde is here. He's a bit of a hero of mine. He's going to be embarrassed about that, but he knows it. But we discuss a lot about pictograms and visual metaphor, visual communication, and a lot of that is based on metaphor. The road signs that you see, metaphors, essentially. So that's the background to that. It's just been a key interest, and it is, if you look at things like clinical outcome assessments, metaphors are at the core of that. Patient-reported outcomes, real-world experience, interviews full of metaphors. Patient-reported experience measures, metaphors.
Can you give us some examples for those who don't know what we are talking about?
I will in throughout.
All right.
While we talk. But one of the challenges that we need to have as communicators and as researchers in the patient voice sphere is to make sure that the metaphors translate comfortably across cultures, and we should never make any assumption that Nora and I were talking about pain, the expressions of pain yesterday. And so, for things like neuropathic pain, you have descriptions like shooting, stabbing. What other examples can you think of? No, shooting, stabbing,
pins and needles,
burning, pins and needles,
burning.
And we can't. When we do things like linguistic validation of clinical outcome assessments, there tends to be an assumption that this will just be fine across languages, but very often it's not. And I remember seeing testing in about 15 languages an item in a clinical questionnaire that says, I feel like I am waiting for the other shoe to drop. And, so we didn't handle the translation, but a machine did in those instances. And the machine translated that literally across, from languages as diverse as Spanish for Argentina to, I think it was Taiwan, China.
All right.
Thai in between, and Arabic for United Arab Emirates, and it just didn't land anywhere apart from the source, which that is. I wrote about this time last year, which you like the title of this, Catherine. I wrote an article called "Not the Yellow from the Egg."
Yeah, nice one.
So, and that was about using figurative language in clinical outcome assessments, and my point at the time was that if it's not adequately localized, then the metaphor or the idiom becomes a folly. It becomes a really stupid thing to do. And so my attitude at the time was, don't use them. But I've discussed this. It's a favorite topic of conversation between Nora and I. So you can imagine how exciting those talks are. And Nora points out that, we need the metaphor, we need the idioms, because this is how the patients communicate. So the challenge is to make sure that those are adequately and appropriately adapted. It's about resonance. So, a person in Cambodia, for example, might read stab in pain. And yes, okay, I get the imagery of pain that stabs, but we don't say that.
Yeah.
So, so what's the alternative? And I think just going back through history, I think metaphors have been with us since we were first sentient. They've been with us probably since before we were Homo sapiens. You know, it's really curious how you look at the night sky, and every culture saw the Milky Way, or the Milk Street, as you call it. I love that.
Yeah.
The Milky Way as some kind of system of travel. It's either a road or a river.
Yeah, right.
A flight path for birds. That was a common one. And so that a canoe as well in indigenous cultures as far flung as the Pacific to the Americas. And what's interesting is that it wasn't just the stars that cultures saw in the Milky Way, but the dark clouds as well. Some cultures saw significance in the dark parts of the Milky Way, and then from there we started to build shapes. We started to see shapes in the sky. So we saw the hunter, we saw the
Mhm.
we saw the balance, the scales. We saw water, the water carrier, and obviously those are not there. It's just as we perceive them, and different cultures perceive different shapes. And so what was the purpose of that? Why has that been a constant through human civilization, or before we were civilized? It was because we were trying to give form to the unknowable and to the unknown. So we tried to make sense of what we were seeing. That's why we see faces in mountains. And I've got a wonderful photo of just a pavement near where I live, where it looks like the Queen's head as she appears on a stamp. And I couldn't find it. I wanted to show it, but I've got my one of my children pointing to it. So yeah, the Queen of Britain is in the pavement and it's how we see things like the Turin Shroud, and that it's all of it such as some form of metaphor.
This all really reminds me of the simple childish game when you look in the clouds and see and try to see something, you know, like to detect something.
Yeah.
As you said, yeah, it just makes the world a bit less complicated if you can picture things, maybe.
Mm-hmm. Mm-hmm.
Also, it's also a technique to remember things. So it's a technique that I tell my kids to, like when they have to learn vocabulary or something, or before we moved to Sweden, we started learning Swedish, and I would also picture everything. I would I remember me on the street, like there was a street going into our house, and then there were 3 neighbor houses, and on that street it was brand new and very even, you know. We drew like the shape of a human, and then we wrote in the arms, for example, the Swedish word for arm, and the legs and all this stuff to picture it. And I remember it still, what that looked like, and my kids won't ever forget those vocabularies. I mean, now we know them anyway, but still.
Mm-hmm.
It's a very good way to picture something, because I said that in another call, I think with Noor last time, that different areas in your brain get stimulated, and then you remember it much better than when you just have like a list of text, or like the dense text what we used to write in, like blocks of text. We don't do that anymore, because we learned that it is much easier when you can like kind of structure the text you see, even if it's just in pictures, right?
Yes, yeah. And so when I was the reason for this is because I've been doing a lot of heavy reading around metaphor, so that was the catalyst of that was your book, actually. I wanted to look at it more systematically, and I do think, you know, I said that the metaphor is used to give form to what we don't perhaps understand, or we're trying to understand it. But also I think it does function as a device for remembering, a mnemonic. because I mean, just look at how we started using the patterns that we saw in the sky as navigation, and it's how the ancient Pacific Islanders went from island to island to island just through the patterns that they saw in the sky and the seasons. And it's how we planned agriculture. It's how we planned hunting. You know, like, for example, there is evidence that there was trade between Pacific Islanders and the peoples of Colombia, Ecuador, Peru, northern Chile, centuries before Columbus, and the only way they could do that was by the metaphors they were seeing in the sky. And I think again, you know, it goes to creation myths around the world, and the you know, the basically metaphors to try and account for who we are, where we came from. So life started through breath. That's a common metaphor across mythologies. The world came out of a womb or a void in the Bible, a womb in other cultures. And you know, there's other metaphors as well. I've got here. Here's the only I can't remember the word, but thing to illustrate it is, this is from the Epic of Gilgamesh, and it's basically the Babylonian, Akkadian, Sumerian version of the biblical flood. So it was you know, obvious that the Tigris and the Euphrates were flooding from, you know, very often actually, and the metaphor was used to explain why it was happening. And obviously it was because we were angering the god or the gods, and so that's what we were trying to explain to ourselves. And I find, and that brings us to health, very ancient health beliefs. There's an amazing story of you know, just dental health in ancient Egypt, and the whole area of that. And so Ramesses II lived until he was 92, and because the bread was so full of sand that everybody's gums were just exposed when you got to a certain age. So people, you would be lucky if you lived past 40 in that culture. And so Ramesses II would have been in extreme pain, and he was at the height of, you know, you couldn't get higher than him in that society, but he had nothing to deal with that pain. And you know, that is similar to kind of how helpless we are with neuropathic or chronic neuropathic pain and chronic fatigue. We really don't know how we can treat those today, but this is just simple tooth pain in the back. And I was wondering, what kind of metaphor would he have used to describe that pain? He would have attributed to something, and the answer is further north in ancient Babylon again, where there is a prayer to the toothworm. So they envisaged the pain as a worm that was actually inside the tooth, and that shaped health belief. The belief that you had toothache because there were worms in your gum that were you know, basically being a parasite in your mouth.
Oh, that sounds fantastic. But I can imagine some kind of pain does feel like something is inside you, and especially if it's like pounding, it could be that something is there. Yeah, I can imagine that.
Gnawing and biting inside, and just burrowing inside you, and so that again. So we were talking when we first planned this about the extent to which metaphor shapes belief. And shapes how we view the world. And there's always been a debate in linguistics between linguistic determinism, where language determines thought, or thought determines language. I mean, we don't even know which way that goes around, and linguistic relativism, where yeah, it has some role in shaping thought, and that's clear in, like, if we look at the AI debate now, where the metaphors we're using for AI, we in European languages and in North America, we're using metaphors that instill fear. And so we have all of this anxiety about being replaced by the machine. Whereas in East Asian cultures like Japan, Korea, China, AI is presented to them as a backbone, as a spine, as a tool. And you don't find any angst there about human replacement. They see it as humans working with the tool. So that shapes policy as well. So the policies in East Asia are about working with this amazing technology, whereas we, because of the choice of words that we try to use, and also it feeds into sort of like the tech gods, that we're at the mercy of them. Please let us keep our jobs, kind of thing. And so that is an example of where language is shaping policy and shaping reality for us. And so I've caught sort of give us a question, because I've lost me.
Yes, it's interesting what you're saying. It's something that I see in the population in Europe or North America very often, is that we are always so fear-driven. Everybody is fearful. The news are just awful. You don't want to even like turn on the TV, because everything is so, yeah, as you said, it's all about war and fighting and stuff. But it's also always a way of perception. So what Noor said in the podcast about healing words, it's you know, you make your own reality too, and if you only use negative words, then your mind will be negative. It's all about affirmation. It's all about I mean, I know it's not always easy to stay positive, you know, the world is crazy at the moment. But maybe, especially also when it comes to diseases and conditions, using different words will help patients to feel less frightened and alone. Instead they might feel cared for, you know. So, but it's very interesting to see that the Asian folks are having such a different perception of AI than we do, which makes a lot of sense, because they are very, how do you say, like futuristic and technical, very smart people too, very often. So yeah, I didn't know that. Thank you for enlightening me.
I think what Noor said was she wrote an amazing article on our blog called, I think it's The Architecture of Belief. It's about basically manifesting, and it emerged just from a spontaneous conversation that we had. Yeah, she's pretty wise, that Noor person. Yeah, but
very true.
You're not gonna steal my thunder today. That's another metaphor. It's another metaphor. No, you're not gonna outshine me today, Noor. I'm not gonna let you.
You know what I also thought was very interesting, what you said, or what you showed us actually, that metaphors, most people think it's words only, but it's actually not. As you said, it's also a thing, you know, it can be anything. Like I told you in the beginning about the forest, we use images as well. We use emotions, and we can use words to put people into emotions through metaphors. But we can also use noises and pictures and all this stuff, which then also help or work as a metaphor.
Yes.
So yeah, I find it very interesting.
Absolutely, and so I think that is a really good segue to just talking about metaphors in health, and you know, some of the COVID, for example, was a very rich seam for metaphors, and there were two main camps. There was the war metaphor, we are at war, there was the journey metaphor, which was preferred by Angela Merkel, where it's a journey. We have to do this, and so I've never really been those metaphors then were really powerful at that time, and it really did frame how we dealt with the pandemic. And I've never really been an enthusiastic monarchist. I mentioned the Queen earlier, but I've sort of like, well, what are they for kind of thing. And we realize what they're for when our Prime Minister at the time was a very stupid man in terms of how he managed COVID. And he was dead almost. And basically the Queen started speaking to us, which was unprecedented. And she brought the metaphor of peace and unity, and it was going sort of, it brought something back to like 1945 and that kind of new start and unity. And she was mixing the war metaphors with the metaphors of peace. And I had the embarrassing question to answer from my 9-year-old son at the time: "Why are you crying, Dad?" So
why is that embarrassing? It's not embarrassing.
It was just because I was never really bothered much about the British royal family, but at that moment in time, those words were really powerful, and I appreciated them. I still do, and it was just a contrast between the leadership of the Prime Minister and the leadership of, look at him. How did we elect that guy? It's just, look at him, Boris Johnson, and the leadership of the Queen. Who was always just a very consistent, offered consistent leadership. There was an epidemiologist in the UK called Jonathan Van Tam, and he used to use train metaphors, just absolute delightful break from the war and the it was about and the journey, but it was kind of within the journey because he was using the train metaphors because he likes trains, and that's a beautifully British thing, just to be interested in trains and that kind of thing.
Is that so? Okay.
Yeah, those metaphors are lovely, where it's like we can't get off at this station just yet. We have to wait for the signals to change, i.e. the vaccine and that kind of thing. And I think those metaphors worked. I just want to take a diversion to what we were talking about before. Is I've always been interested in the kind of military metaphors in business. So after the Second World War and subsequent wars like the Korean War, and this is beautifully illustrated in the TV series Mad Men. So you had all of these guys who had military service going into business, and so they were using the metaphors of business, the metaphors of the military in business, and those are still around today. Like things like "hit the ground running" is about jumping from a parachute and being able to hit the ground running. I'm not sure many did though, but you get what I mean. And so that was the Mad Men era, and it's still with us, and it still shapes how we see business. And one of the things that I found really interesting is that is kind of morphed into, by some certain sectors of the business world, morphed into kind of mafia type metaphors. I remember working with one guy about 20 years ago who had the Godfather ringtone on his phone. So he was a mafia fantasist, I guess. And he would say things like, sit back in board meetings like this and let's send the guys around. For pharmaceutical companies that were slow in paying. Can you imagine that? And it's there is that type of subculture in British business and the US business, and I find it really tedious. And again, you talk about manifesting and shaping belief. That's why we get so many managers who are psychopaths, because because they're using those metaphors. There's so many of them. Honestly, it's just.
It's a perfect example how it shapes the community, right? How it shapes people, the language we use.
Yeah.
Nora has a question or a wish. She says, could you elaborate further on the way communities create metaphors according to their Lebenswelt and how these get lexicalized and become part of the local language as applied to cultural adaptation of COAs, and how developers could tackle these issues to get back to the medical writing?
So I want to see proof that she actually said Leben. She said Lebenswelt.
Yeah, she did.
I thought that was your edition.
No.
No, you need to take over this, because we discussed some examples of this yesterday.
Oh, no, I want to listen to your views, and maybe Catherine's as well, just kind of invitation to discuss this further, because it's a fascinating subject. Really.
It is, and
but you can give us your opinion. It's very interesting to this is this open round. But if you have anything you would like to share, I know you have.
There's tons of examples, like when I was saying earlier before about the stabbing pain and shooting pain and that kind of thing, and where people do understand them, they do understand what that means, but it's not part of their metaphorical world. They wouldn't say things like that.
Well, I think if I look at the way communities create metaphors, it's very depending on where you live. If you live in the desert, you will use different metaphors than if you live in the rainforest, for example. Or, for example, when it came to translating How to Speak Cancer, which is, for those who don't know the book, I use garden metaphors to explain everything around cancer. And when I got into the translation process, I wondered if we should localize those metaphors as well. With my How to Speak Cancer family, we decided to keep it as it is, because the illustrations are written by or drawn by my daughter would need to be adapted to, and that in now 18 languages. So we decided to stay with the garden, as we thought the garden works for everyone. But in an ideal world, with a lot of time and money, I would have liked to, for example, here in Sweden, we have a lot of lakes and forests. So I would have used for the Swedish version, the forest as a metaphor. And when you live in Australia, for example, you could have used either the desert for those who live in the desert, or the rainforest, because there's a lot of rainforest. The same goes for South America and all this. So, but you see the difficulty, all the illustrations, and then the whole, it would have been transcreation. But this is what I think how communities create metaphors, is where you live, and also you're.
It's making sense of what you see around you. That's how I articulate. That's what I was lost for words to articulate. It's just what you see around you. And one of the things is that I'm not convinced that a lot of people working in the COA space understand metaphor in the clinical outcome assessment space, or in medical writing in general. I don't think there's enough understanding of metaphor, and it needs to be, because as we said before, it is how patients, or how, I mean, we say patients, we're talking about people. It's how we express ourselves. I have a frog in my throat, just that kind of thing. I'm feeling a burning pain, and but the challenge is that this has to go back to, this is something that Laura Rolfie said in the famous podcast from January about clear communication. This has to be incorporated, embedded in the beginning, you know, whether it's a consent form or a clinical outcome assessment or a patient information leaflet. You need to be thinking, you need to be writing for the world. You can't be writing just for the immediate clinical culture that a developer is working in. You've got to be thinking, okay, so yes, this COA is being developed for this particular culture because that's my environment, that's what I know, and it's based on real world evidence interviews, unmet need interviews, kind of thing, from patients from the same culture who were using very specific metaphors. We need to be expanding that at least to include more than one culture, and that needs to be embedded in the production of that message of whatever written material that you're developing. And also you need to be thinking about translatability of the metaphor right from the very start. It can't be an afterthought. When we're testing metaphor in the cognitive briefing stage of linguistic validation, that's already too late. It's far too late. It's at the end of the process. It becomes an afterthought.
That's very interesting. I think that metaphors are not thought about because they happen so like subconsciously. I never thought, when I wrote my book, I never thought, oh, how could I, which metaphor and all this. It just happened somehow that I put it into words that I found more understandable. And actually, only when I released the book, when I published the book, I understood, because of people like you who told me how that like reflects. And first, then I really started thinking about what I did. So a lot happens subconsciously. And I think that the people who write, like a COA, for example, in English language, mostly it's in English, the source language, they write it for their own, where they come from, you know, like for their own people, let's say. And in my opinion, when I just got today, I got a COA sent for translation, a forward translation, so the very first step. And then I wrote my notes into this translation where I would localize that. And for me, this is the step where it needs to be implemented, to at least think about, like, if I get a PO from someone for a translation for this kind of work, then I want that there's written localize measurements and units and also metaphors into your language, you know. Maybe this is a very simple step, which someone who lives in the US can't, you know, that the original writer can't know what that would be, you know. We can guess, but we can't know.
And sometimes there's a thing with the linguistic validation workflow of clinical outcome assessments that is the concept elaboration. And basically that just breaks it down, passes it item by item, and explains what the question is. And some people do it well, some people do it appallingly bad. But one thing that I've seen, even amongst people who do this well, is when they see a metaphor or an idiom or something like that, all this should not be translated literally. But it should, what you should be doing is signposting. This is a metaphor that is rooted in the source language, in the source culture. Care needs to be taken. Think of what metaphors land. It's about resonance. It's about what people of the target culture can understand and can relate to. That's what should be happening, and there isn't enough of that, in my opinion. And when I look back at some of the ones I've done in the past, I think, I stopped short of explaining that this is a metaphor. So it's a criticism to myself as well. So I think we need to talk about this. I have a question.
Yes.
for you, and it is. So, I mean, like this one, Susan Sontag, where she's talking about, you know, the war metaphors, the battle, cancer is a battle. Sometimes it is detrimental to the patient because, you know, if you die, it means you've lost a patient and the immediate circle. And, you know, the battle can be stressful, the battle imagery can be stressful, but some people find it useful. So in many respects, well, her argument is that it depends on the person. And I'm interested in where did you get the plant metaphor from? Because it's quite rare, I think.
Well, I thought about different metaphors, like traffic, for example, which I find very suitable for cardiac diseases, or like for how to speak cardio. I would maybe think about that. But when it comes to cancer, I wanted something that makes you feel cared for, that makes you feel calm and peaceful. And I remembered when I was still nursing, I took my patients out in the park from the hospital, and we would sit there and eat some ice cream and just talk. This would be the place where I would put them to talk. I wouldn't talk to them about heavy stuff in their room if I wouldn't have to, you know. So it came just naturally to me, and I love my garden. I love nature. You know, you all know that. I love to be in the forest. One of the big reasons why I moved to Sweden is the nature and not so many people. So I have enough nature for myself. So I remember I was sitting here and I was looking outside. I have like a really nice view there to the forest, and I have a very big backyard compared to my house in Germany. And then I thought it would be so nice to have the patient that I'm always having with me on my desk. Like when I write or translate, I always have some patient in my mind with me on my desk. So I took this patient into my garden and started talking to the patient and started like, you know, in my mind. It sounds a bit crazy, but this is kind of how it happened. Where would I want to talk about heavy cancer stuff with a patient? And that would have been in my backyard.
Did you have ethical approval to use the patient in that way?
I did think about that. But my patient is very nice. He likes most of the things that I do. So
that is an example of using a metaphor from your immediate environment.
I always do that, but I don't usually, you know, I'm giving courses as well. I had the clinical trials translations for patient course the other day, and I'm so not a fan of just blank text on a presentation. I always want to make people remember what I said and picture stuff. So I used Alex. He was a glioblastoma patient, and I guided him through the journey of a clinical trial process, and along with this, the translations, I created an image of him, and he's actually based on a real patient that I had once. So for me, this is also, it's very real, you know, and I do the same with all my courses. Actually, one interesting metaphor, which doesn't have anything to do with my book, but I found it really funny. When I was in France last year, I had to give a presentation about the US and the European regularities of clinical trials. And it was like, oh my God, this is such a heavy topic. And then I had 3 different presentations when I arrived there. A very cold, like regulatory one, lots of text and lots of, you know, input. Something in the middle, and something very easy. The one in the middle was the one with Harry Potter figures. I used Harry Potter figures for the FDA and the EMA. They were all like characterized in one of those characters, because I'm a really big Harry Potter fan. So, and I was so nervous for this presentation, but when I was done, people came to me and they were like, hey, this was fantastic. I will never forget about this, because I made them picture things with something that was very known. And that was only because I was so desperate that I found the topic so heavy that I choose something very easy and easy rememberable, like Harry Potter. So this is another part of metaphors. And what does that do? It doesn't only make like cancer more understandable. Like let's use this example. A moss is a noticeable bump in the garden soil, like something, meaning there's something there. So I see the bump, but I also see myself in a garden, and this transports the feelings that I have in a garden. And most people feel well in a garden.
Mm-hmm.
I don't know so many people who don't feel well in a garden. Actually, I don't know anyone, but there might be someone. Yeah. Now I lost the thread.
Yeah, no, I was thinking now, just fast forward to the translation stage. So my last count is 18 languages, I think.
Yeah, we just got another one last week.
Which one was that?
Oh, now you're catching me. It's a difficult one.
Well, the one I'm most interested in is Urdu. So that is because most of them are European, aren't they, the languages that you have for translation?
Now we have a lot of languages. This is why I can't really remember all the languages, but we have. I'm really proud actually of the mix we have, because I find that we cover a lot of soil here. Mm-hmm. I'm just opening the sheet. Urdu is actually it's also culturally extremely interesting.
Exactly, that's what, because it when I looked at the list of languages, I thought that was kind of the area where, in my opinion, the plant metaphor would either land or not land, or people could acquire that metaphor as well. Say, oh yeah, that makes sense, because basically through you, people are acquiring the metaphor of the plant.
Yeah, absolutely. I mean, I do ask all the translators if they find it relatable. For example, Sinhala, like Muhammad, who is the translator for Urdu, he says that people do relate to that garden thing. And if I live in the desert, I have lived in the desert for 6 months, the red desert of Australia, like right in the middle of the center. And I still, you have those tiny gardens, but with different flowers and with different plants, but you still enjoy this tiny garden you can manage in the desert, and the same goes for Pakistan, Muhammad said. So it seems to be a concept that works quite well. I also then thought, does garden work for men and women the same? And I asked you, I remember, and I asked my husband and a few other guys, and they said, yeah, it does work the same, because it maybe they are not the ones like looking after the flowers, but they still enjoy the feeling you get from nature. Yeah.
I let my garden just grow wild for the past 6 or 7 years. Just let it go wild. Get all kinds of animals in there as well.
It doesn't have to be extremely tidy to be nice.
No, exactly. That's why I like it.
Yeah,
I really like it because it is just hedgehogs and things like that the neighbors don't have, because they've been more neighborly and careful. I imagine from their point of view, my garden looks a right mess, but I like it.
It's also, why do I love nature so much? It's maybe some spirituality behind that. I talk about that too in my book, and also in the clinical trial book, because this for me is very important. Also in the battle of a cancer disease or any other disease. I mean, in the end, we go where we come from, is my opinion. I don't think we just vanish into nowhere. And our very core being is a natural being. We are natural beings. We are biology. We are animals that come from, from the nature. We don't used to live in houses. We don't used to live in a lot of luxury. This is just something on top, but this is not who we are. And this is why I think that every person, especially those who live in, like I grew up in a big city, in the main city, and I always was drawn to nature because, I don't know, I just kind of knew that I belonged there. And when you get to some managers who manage like big, massive businesses, when they get into the forest without any headphone, without cell phone or anything, they come to themselves. They are you can connect with yourself. And this is also a reason why I always use metaphors in nature. As I said, also in the clinical trial book with Keith, we used nature or geographic metaphors because this is where we come from. This is where we originate.
Yeah.
So I don't like traffic. So actually, I might not use traffic at all.
So I guess using that metaphor, there's something, you talk about the circle of life. Not to quote Elton John.
Yeah, I have it. I hear it.
Yeah, no. Then you'll not unhear it for the rest of the day.
Yeah, right.
But it is true, the circle of life, and I believe. I mean, it is biological fact that we basically disperse our molecules and we are absorbed into something else, and in that respect, that is reincarnation.
I do believe in that. And this, for me, like when I grew up, we are almost hit the hour, but let me tell you this. I grew up in East Germany, and East Germany was no religion at all. It was kind of like, it wasn't officially forbidden, but there was no religion. And when I started nursing in a short-term care home where many people died, and this was in a Catholic hospital, I got in touch with beliefs and people who believed, and I was jealous. I was jealous that they had so much power to go through such dark times, but they were always, they gave me, they took hand of, do you say took hand? They took care of myself. Because I was the one being really sad and desperate for the person who was dying. I wanted to help her. And this was when I was like 19 years old. And then I learned that I was thinking I should believe in something. And I started to read a lot about the ontology, about how to help people when they leave the world. And now I'm 39, 20 years later. It was quite a journey, but I do stand my ground, and I know where we're coming from, and I know that there is so much more than just dying and not being here anymore. It doesn't make it less sad that someone is dying that you love, but it also gives you hope that this one is, being relieved from this heavy burden sometimes that we have at the end of our lives. So for me, it makes it much easier to also see a sense in the whole world, in the whole being. Why am I here? I'm not just here to die. I have these discussions with my daughter a lot. So yes, I don't know why I told you that, but I felt like I need to share that.
It's all part of it, isn't it?
Yeah, definitely. Yeah, reincarnation was the question. And trees, flowers, everything comes again, that it dies, but then through the seeds, it comes again. And why wouldn't we do that? Right. Well, Mark, this has been an amazing talk. I knew it's going to be so rich from your side. You have so many interesting insights and a lot of food for thought now. Thank you for being here and for being there for me as a friend as well. And thank you, everyone. Does anyone here have a question or a comment? Anyone who wants to share some thoughts? Oh, I see. Andrea wrote, metaphors make language more colorful. I don't think avoiding metaphors is the solution, but to find the equivalent in each language. As far as my experience goes, every metaphor can be localized if we consider transposing only the meaning, and it makes a text more readable, patient-friendly.
Yeah, and I think that's the error that I was making. So in that article, not the yellow from the egg, I was kind of like a metaphor autocrat where I wanted to kill them all and get rid of them. But no, I think, like I said, conversations with no, just it, and also your book. No, we need the metaphors. We need the metaphors, because otherwise, imagine what communication would be like without them.
Yeah, it makes it much more human, I believe.
Yeah, exactly.
Yeah. Less cold and sterile, as clinics are often, and clinical topics. Let's make it a bit less frightening, less cold, less impersonal. We got another comment. Great topic. So interesting to hear all the different roles of metaphor and how to view metaphor. I have to go now, but I will hear the session and the reply. Thank you. And Noor wrote, I also wonder about intercultural metaphor as compared to intercultural.
Those questions are just too clever. That's just
Noor, you give it up.
No, I think that is really interesting, intracultural and intercultural, because there are, like, I come from the northeast of England, and we have very different metaphors to people in the United States or people in London. Scottish people have very different metaphors to English people in how they communicate. That's why I wish Jamie was here, because he would be able to tell you that. Or there are big differences, but I don't have any answers. No, sorry.
But it gives you food for thought. We can think about it. Does a person with greater age use the same metaphor as a child to say how his throat feels? That's a very interesting question. I will think about that. I have no answer, but does anybody here have a thought about that? Any answer? Would your grandma use the same expression than your child?
That's true, but that just typical, just using a deliberately complex question just to make me look dumb.
No, it's just the metaphor of the frog was amazing.
I know.
I just realized, do you say that? Like your mother says that? Like, I have a frog in my throat?
Yeah, that's pretty intense. I don't even know if people say it in the United States or elsewhere, but it's definitely a very British thing to say.
It's a very German thing too.
Is it?
In Spanish, in Argentina, we say tener un gallo.
Meaning?
Un gallo. Gallo.
We say like that, horrible. But anyways, it is what it is. But we understand the concept.
Yeah.
Yes. It's just that I was wondering, now young generations, with all the influence of globalized societies and everything, if they start using different metaphors for explaining how they feel and the sensations they have within the narrative that they have to tell the doctors. Now, it's true that I'm into the part of experience, not so much in patient-reported outcomes, but maybe PREMs. But to me, that's something, because we all tell stories when we talk to a doctor, and we describe everything we feel in terms of metaphor. Really, it's very difficult not to do it. So I was wondering that in order to be more inclusive and diverse when we design questionnaires. But that was it. It wasn't.
This actually opens another question. For once, Karin says it's the same. It's the same in Dutch. They use the same. They also eat frogs. Poor frogs. That's true. I wonder, why do you think there's a frog in your throat? I never thought about that. That's exactly what I mean. It's subconscious. You don't think about it. You just use it. You know what I also wonder is, these days, when I look at my kids who are teenagers, this globalization of the world, will we use metaphors worldwide differently than we did like 50 years ago? Probably we are going to use the same.
It's very possible. There's a really interesting one in Korean that came from the city I live in now, Leeds. So they say the English word Leeds to signify a time that was, you're going through a time that wasn't as good as the time before. And it has a reference in something really specific in terms of the Premier League football, of a football player who went from Leeds to Manchester United, and he didn't do very well at Manchester United. Why on earth that would resonate in Korea and become an actual lexical item and a metaphor and an idiom, I have no idea. Just some things stick, some things resonate.
I wanted to ask you also, because I'm thinking now that we are used to, because, okay, we're children and our parents are the ones that tell us about the frog, let's say, no? We get sick since we are very little with flu or very common ailments that we have since we are little. So we absorb from our parents all that lexicon. But what happens with other conditions that we develop along the course of our lives, and we don't have words yet to describe them? We have to learn new words to say symptoms that we didn't even know we could have. It's a new thing. So part of, I guess, the learning curve of having a condition is not only going through the trauma, etc., learning about the illness in general, but also being able to articulate, because it's absolutely new. So I guess there's a set of metaphors that are going to come with some kind of conditions that are more common in others that, you know, will be developed in adulthood, and we don't have the words for that. So how do we find them? And many times it's us, medical writers, bringing those words in information leaflets or information for patients, that we educate them in how this feels. And so it's fascinating thing.
Exactly. So then metaphors can be acquired and learned and acquired. It's like the plant metaphor. It could be that, for the sake of argument, in Pakistan, nobody spoke about cancer, because cancer is a taboo topic in a lot of cultures. Nobody spoke. It could. This is just conjecture, but nobody speaks of cancer with that metaphor. But it could be something that gains currency and is used, and then Catherine is famous. Well,
yeah, and patients associations are responsible also for giving words to that, and like subgroups, right, in different places, creating the new lexicon that people will need. So,
and there's so many diseases that are metaphors as well, like lupus is a metaphor.
I wonder, there's also, I'm just thinking metaphors seem to be so natural, because when I think about my concussion, when I was at I was very lightheaded. I wasn't able to really think, otherwise I would have gone to the doctor directly. So this is the state I was in. Even I didn't understand what I was, so I was confused, but I was still able to describe the feeling I had as if my head was underwater. This is what I kept saying. I feel like my head is underwater. So it must be something that is very, that comes very natural to us to speak in pictures, right? Also dementia patients, they are very descriptive in their language, and if sometimes they lose language at all, and then they use drawings and stuff, then we come back to what we do with Yuli, using symbols, to express ourselves.
Yeah, I think it touches an issue very important, which is relatability and resonance that Mark always talks about. because it needs to relate to our lives. Like you had the sensation of being underwater, you had it since you were a child, so it was easy to say, this is similar. No, it's quite like that.
Yeah.
But when we translate and we can't get that relatability because you are in a desert and children don't get their heads inside the water, you may think, no, water is pervasive and why not? But it's not an experience that they can relate to. So it's much more complex. It's not just trying to find an equivalent, but also really an experiential equivalent, which that takes a lot of research really from the linguist part.
And sensitivity, and also this explains exactly why this sort of work should be done by natives. Even though I'm really good in a language, I would say I'm quite good in English, but I wouldn't say that I could pick those metaphors for someone who lives in the Lake District or in the US. Like, you know, the US is huge. There might be on the East Coast a different metaphor suitable than on the West Coast.
Yes,
so
absolutely.
This should be, it's a real good indicator why it's so important to have linguists working on material for the people, from the people, you know.
Yeah, and it takes us right back to that the webinar we had with Laura and Claudia in January. That's why I keep saying it's an important podcast, because I had never seen many people articulate what I felt about health communication.
It's interesting. I think that a lot of people think so, and but as I also said once, maybe we are in a bubble. You know, people worldwide have different problems, and they use metaphors intentionally, and but we are, on the other hand, we are on the side of the table where we can decide, where we can take time and think about that, and make it, for those people who use it intentionally, easier to understand what we want to express, you know. So I think it's extremely important also with clear health communication that we focus on localization to make it more relatable for everyone.
Yeah, and then there are just we can import practices that are done elsewhere, like translatability, just thinking across as many languages as possible, and AI can help with that as well.
Well, you can ask for different examples and then pick your best if you're not creative yourself, for example.
Yeah.
But in the end, it's always the human choosing, and that this is also, I'm not against AI. AI makes brainstorming much faster, maybe gives you hints, but you are always the one the one choosing which one to use.
Yeah, I think AI is used for the wrong things. Like, it shouldn't be used as translation production. It shouldn't be used as writing production, but it should be used as a tool to enable that. And that it's an incredible tool when it's used properly and appropriately.
I mean, it can help just to speed things up. You know, there's so much stuff that needs to be around the world, and so much communication that can be done faster, maybe, but always on the terms of a human. You know.
Yes. Yeah. So that's again using metaphors of human oversight versus human steer. Everybody's using the human oversight thing, but human oversight means that it's an afterthought. The work is already done, and we're just checking it. We're just rubber stamping it. Human steer is directing it from the beginning and having a human input all the way through, and that's how the translation workflows should be, with using that metaphor of steer.
Definitely, yeah. Well, I think this is gonna be another episode. We could just keep talking as always. It's so nice with you guys, but I think we should cut it for today. Thank you all for your nice messages in the chat as well. We seem to have hit a nerve here again, and I love talking about it. Let's meet another time. and go through more metaphors once you wrote all your articles, Marky?
Well, it could be a book, I think. I mean, if you have a look, that there's a pile of books over there, and that's the reading I did. Wait, hang on the desk there. That's the reading I did for this webinar.
Wow.
And I've got a bookshelf over there, and the whole lot is about metaphor. So there's enough there to write a book. So let's do it.
Wonderful. I'm looking forward to it, Mark.
No, you're writing it.
Yeah, we are writing it.
No, you're gonna write it.
Well, let's discuss that in another talk. Thank you guys for being here. It has been amazing. It's an amazing start when I came back to proper life again. And I will see you around next week, and have a